Blackhead and whiteheads is a very common problem with a lot of people. But why do these blackhead and whiteheads occur, and what really causes them? What are the reasons for their occurrence, and how can we treat them? What are the treatment options? What are the creams, lotions that we could apply for them in order to treat them, and what are the things that we could do so that we don't keep getting blackheads and whiteheads every few days or every few months? All these things we are going to be learning about in this video. All these timestamps I have mentioned in the description box below. Hi, I'm Dr. Nirupama from Zolie Skin Clinic, Delhi, and I make videos on skin and hair related issues on this channel. You can subscribe to our channel and also press the bell icon so that you get notification every time we upload a new video. Also, you can follow me on Instagram, where I upload a lot of informative videos on skincare and hair care. So, what are these whiteheads and blackheads, and how do we get them? Our skin has hair follicles, and alongside the hair follicles are oil glands which secrete sebum or oil over our skin. The sebum or oil is secreted through an opening known as a pore, and sometimes these pores might get clogged because of dead cells and sebum, and this clogging might be present underneath the surface of the skin, known as a closed comedon or whitehead, and sometimes these might get clogged by dead cells and sebum comes in contact with the air and it gets oxidized, leading to its black appearance, leading to a blackhead or open comedon. These are precursor lesions of acne. Comedons can cause acne, and there can be intense inflammation and pus formation. There are multiple reasons why somebody has blackheads and whiteheads, and in this video I've tried to mention some of the important reasons why you could be getting a blackhead and whitehead. There can be many reasons why comedons or blackheads or whiteheads occur. Some of the common reasons being hormonal changes, usage of oil-based and comedogenic products, exposure to pollution. Sometimes certain medications can also lead to comedon, unhealthy diet which is rich in high glycemic index, and food which is very sugary, scrubbing or overexfoliation, smoking, family history of comedons, and applying heavy makeup and not cleaning up brushes on time. We've discussed about how blackheads and whiteheads occur and what are the reasons for their occurrence. Let's discuss about the treatment options. So you must realize the treatment of comedons or blackheads or whiteheads is similar to the lines of treatment of acne. So we would want to decrease the oil production, the sebum production, and also we would want to unclog the pores. So there are various topical creams, gels, lotions that are available that help treat blackheads and whiteheads. If not, then we switch over to certain oral medications that we can prescribe, and there are certain procedures that we could do in the clinic in order to reduce this persistent problem of blackheads and whiteheads. Salicylic acid is a very important ingredient that we use in patients with blackheads and whiteheads. It's basically a keratolytic, as in it tends to break down the excess sebum or oil or the dead cells that are clogging the pores, so that the pores are unclogged and the problem of blackheads and whiteheads, comedons is reduced. So there are multiple formulations that are available of salicylic acid, like face washes, gels, and there are certain mild peeling solutions that one can use at home. I have mentioned few of the formulations in the description box below. Are also very important ingredients that we use in order to treat blackheads and whiteheads. So how they really work is that they improve the or promote the cell turnover. So they promote cells which are newer and healthier to come up faster over the upper layer of the skin, and so that they are able to replace the older dead cells that are clogging the pores. So they hence help improve the blackhead and whitehead situation. So these are mostly prescription strength. They're basically retinoids and adapalene, and I'm not mentioning any links to any of these creams because these are prescription strength and they are best prescribed by a dermatologist, and you should use them under the guidance of a dermatologist so that they're able to explain to you also how to use them and when to use them. However, I have made a video on retinol serums where I mentioned how retinoids work, and I have also mentioned a few retinol serums that one could use in order to reap the anti-aging benefits of them. Also, we must know that when we apply topical retinoids, they could be purging. it so happens that when the cell turnover is increased, whatever is trapped in the lower layers of the skin may also come up, and also the breakouts might increase. This sometimes makes patients panic, but however, you need to have patience, you need to have faith, and you need to continuously and consistently use retinoids in order to reap their benefits. Azelaic acid is also a great ingredient that one could use. It is a comedolytic agent, and it helps reduce the comedons, the blackheads and whiteheads. I've mentioned a few azelaic acid formulations in the description box below. Benzoyl peroxide can also be used in order to treat blackheads and whiteheads. However, it is just a mild keratolytic agent, so it is not as useful as salicylic acid and retinoid. However, one could also use it. When we talk about oral medication, sometimes hormonal imbalance or disbalance is also responsible for blackheads and whiteheads or persistent comedons. In those cases, we give certain hormonal medications like oral contraceptive pills, and also if the problem is pretty persistent and there is a lot of like inflammatory acne as well, along with blackheads and whiteheads, sometimes we also have to prescribe certain oral medications like oral retinoids, which your dermatologist usually prescribes after assessing your situation and explaining the situation to you. They also tend to be very useful in order to reduce the acne, reduce the comedons, reduce the blackheads and whiteheads, and they are very viable options once we feel that the topical medications may not be working as well for you. If you talk about the procedures, then extraction or comedone extraction is a useful procedure that we often do at our clinic, and even it is done in various salons. So we kind of steam the face so that the skin becomes soft and supple, and then we take a tool known as a comedone extractor and try extract the comedons, whichever we can, mostly the open comedons. With the help of a comedone extractor, blackheads can be extracted. Also, chemical peels such as those done with salicylic acid tend to really help reduce the comedons and the blackhead and whitehead problem. Chemical peel is also a great treatment modality in order to help reduce blackheads and whiteheads. Now let's discuss what we could do in order to prevent these blackheads and whiteheads. So basically, we need to wash our face on a very regular basis, and we need to choose products which are non-comedogenic, oil-free. We need to avoid wearing heavy makeup, and if we apply makeup on a regular basis, we should be cleaning up brushes regularly. We should avoid food which has high sugar content, dairy products and energy dense food. Also, we need to quit smoking. Should avoid the sweat from staying on our skin for a long period of time, because that might also clog the pores. We should avoid oiling our hair as often, because sometimes the oil can trickle on the forehead or around the sides of the face and lead to comedons, and we should keep changing our pillow covers regularly. Also, if the cause of the comedons or blackheads or whiteheads is hormonal, then we could do certain things that could help reduce that by making certain lifestyle changes like exercising on a regular basis, reducing the consumption of fatty food, sugary food, as well as dairy products. If you liked this video and you came to know about the treatment of blackheads and whiteheads, if you did like the video, please leave a thumbs up sign in the comment box below, and also subscribe to our channel and press the bell icon so that you get notification about the new videos that we upload. Thank you for watching.